This video was shot on location at Ulwazi Place, where business meets comfort and serenity. Welcome to yet another episode of the Decolonizing Global Health podcast, a production of the African Population and Health Research Center. I'm your host, Michelle Muthia. Today, our conversation focuses on the Day of the African Child, and we are joined by Nicholas Etyang, a policy engagement manager at the African Population and Health Research Center, an advocate of the High Court of Kenya, and a human rights champion, to unpack some of the gains, losses, and opportunities in advancing children's rights across the continent. Wakili, welcome.
Thank you for having me, Michelle. Thank you very much for that introduction. And really, you mentioned today we are conversing or discussing the Day of the African Child. I'll probably just point out a bit of history on this day. This day is held in commemoration of the children of South Africa who died in Soweto in 1976 on June the 16th. The children were protesting, and these were school-going children protesting against forceful use of Afrikaans as a mandatory language of instruction, particularly in mathematics and social studies. As such, in the context of apartheid, at that point, children took to the streets and were met by brutality from the police. Large numbers of children died. The record stands at above 600. A number of children as well were injured, including police also. The number of those injured is estimated to be at above 3,500. The Day of the African Child is marked on the 16th of June every year, and it dates again, other than what happened in 1976, heads of state at the African Union sat in 1991 to declare this an African Day to celebrate the children and to advance rights of children. And therefore, the official celebration of the Day of the African Child goes back to 1991, when the AU, under the heads of states in Africa, declared this an official day to be commemorated, particularly to advance rights in the context of Africa and for African children. Thank you.
All right. So, just as we start, if you're to score us as African states in terms of implementation of national, regional, and even international commitments towards advancement of children's rights, how would you score us?
Well, that's an interesting question, Michelle. I really wouldn't give a sweet or a common score for African states because they're generally at different levels of implementation of these commitments. And perhaps to just give you a highlight of which commitments we are talking about. The official global commitment on children's rights is the UN Convention on the Rights of the Child, passed in 1989 and officially came into operation in 1990. This provides the overall framework for children's rights. In the African continent, we have our own continental framework as a human rights mechanism for Africa under the African human rights system. We have the African Charter on the Rights and Welfare of the Child, which was also passed in 1989, but came to official operation in 1999 upon ratification by the required number, which is 15 states, for an instrument in the African human rights system to be operational. So today, as we speak, in the global scene on children's rights, which is the CRC or the UN CRC, the UN Convention on the Rights of the Child, 176 countries have ratified that instrument. Actually, 196 countries have ratified that instrument, save for the United States of America that has not ratified that instrument. So when it comes to the question of ratification, which is to be officially bound or to be legally bound by an instrument, then we could say that all the African states have ratified that instrument. Back home, we speak about the African Charter on the Rights and Welfare of the Child. Currently, as we speak, 51 of the 54 African countries have ratified this instrument. So we're only speaking about Morocco, Somalia, and Sudan that have not ratified that instrument, and Tunisia as well, that have not ratified this very important instrument. So as far as ratification is concerned, we would say that African states, for those that have ratified, are at green. But there are other factors to consider. Ratification is only one step. So as to whether these countries have actually taken this instrument to their national laws in terms of domestication, that's a different question altogether. Countries that are at different levels with indicators showing differentiated achievements in advancing rights. Within this instrument, which is the African Charter on the Rights and Welfare of the Child, it establishes the African Committee of Experts on the Rights and Welfare of the Child, which is mandated to monitor the implementation of the instrument. Its seat is based in Lesotho, and it follows or monitors countries on implementation, and it requires that countries report on progress every 2 years. If you look at the official data on reporting, you'll be shocked that many countries have never even submitted their initial report to this very important platform. So my score to the countries is blended. Some countries are on the good, perhaps nearing green, some still in between towards the implementation of human rights instruments or children's rights, continental and global commitments.
Okay. So it's quite a mixed bag.
Quite a mixed bag.
All right. So now going to the ground, the grassroots. What kind of picture does current data paint about the challenges of African children in everyday settings, but particularly those in marginalized settings? And I'm thinking, in terms of health, education.
A very important conversation, and I'll just go backwards a little bit to say, even as we look at indicators on children's rights and various aspects, it's important to point out that both the CRC, the UN Convention on the Rights of the Child, and the African Charter on the Rights and Welfare of the Child establish 4 core principles upon which children's rights should be advanced. One of them is participation, or the voice of the child. And if you look at, again, if I take you a little backwards on the theme of the Day of the African Child this year, which is child-sensitive planning and budgeting, I think that principle becomes very important. And we can come back to how states are responding or really implementing participation of children and sensitivity to child rights in their planning and budgeting. The second principle is the principle called best interest of the child, which really means that for every decision we make, we must make that decision with the best interest of the child at heart in making policy, in executing policy, in making decisions, whether policy decisions, judicial decisions, and all that. And then the third one is non-discrimination, and this really responds to your question, which you asked, whether how the indicators or how the data plays out as far as children are concerned. And I think you speak to the diversity of children, because children are not a homogeneous category.
Yeah.
Again, we make a mistake to think that children are homogeneous. They are of different social settings, different ages, and really the principle of non-discrimination comes into play to look at children in their diversity, the children with disability, children in conflict, children in urban settings and really poor urban settings for that matter, children in rural settings, children on the move, the children perhaps running away from conflict situations, running away from difficult situations. And then the last principle is the right to life, survival and development, which is also very important, primarily tied to the principle on non-discrimination. So if I were to point to you sort of like the statistics in terms of where we are in Africa, my major concern would be child mortality, and we're looking at really West African region having really very high child mortality. You're talking about children under 5 or children not seeing the 5th birthday. If you look at Nigeria, 115 children per 1,000 children die before their 5th birthday. Somalia is at 108, Chad is at 104, Nigeria at 104. Those are concerning. Countries that are doing very well, maybe we could cite Cape Verde. We are talking about Libya, both standing at 13. Algeria doing very well at 19 for every 1,000 births. So that should be a concern for policy makers across the region. If you go to issues around child marriage, and child marriage is a big concern as well. And West Africa again, and Central Africa region tops on that with Niger as one of the countries that has the highest level of child marriage, standing at 76%. If you come to the question on harmful practices, and particularly FGM, female genital mutilation, Somalia tops the worst at 99% of children or persons between the age of 15 and 24 reporting to have undergone female genital mutilation in Somalia. Actually, not 15 to 24. We're talking about age of reproductive age, which is 15 to 49. They report having undergone FGM. Other sectors, particularly in education, again, we see disparities in terms of access to education across the continent. Both the African Charter on the Rights and Welfare of the Child and the UN Convention on the Rights of the Child provide that children should be provided with compulsory and free education. So countries are at different levels on that, and it really concerns in terms of quality, in terms of cost for education in Africa. I am pretty aware of the work the African Population and Health Research Center is doing, and it is a Human Development Unit, if you allow me. They're looking at equitable education in Africa, and they're doing assessments in terms of policy responses in provision for education, focused on foundational learning and numeracy, which is a very important component, and really looking at children at the very early stage to be exposed to learning and numeracy. The other component or the other indicator we can look at is health systems. Quite tied to what I told you about the child mortality rates. And we're looking at vaccine coverage in Africa, still a concern. We look at addressing malaria as a big concern, and addressing nutrition and malnutrition among children, still a big concern. And I'm happy to say that APHRC, the African Population and Health Research Center, has invested a bit of resources in really uncovering this, in supplying data to inform decisions on nutrition. So our food systems and nutrition work really focuses on this, and also our CDM, or chronic diseases management, focuses on the double burden of nutrition. That is obesity as well as malnutrition among children. So we could go on. What I would say is that we are at different levels in terms of responding to various challenges children face. We still have a number of our countries under conflict. We could speak about Sudan, we could speak about Chad, we could speak about Somalia. Nigeria has had pockets of children being abducted in the course of internal conflicts. So yes, children still face a lot of difficulties when it comes to conflicts. And if we do not address conflict, we have our children exposed to difficulties. Children being part of IDP communities in our continent, children being part of the refugee communities in our continent. So we still have a long way. We've made those commitments at the global and the continental level, but I would say we still have a long way to address those challenges.
Okay. So just borrowing off of the theme for this year, how do we involve young people and children more in terms of the research, advocacy, and even the policy making process? You spoke a bit about what APHRC is doing in terms of these 3 areas. So what are some of the lessons the center has learned in terms of youth and children engagement in these 3 processes?
Thank you very much, Michelle, for that question. As I was mentioning, in terms of principles of implementing children's rights, the principle on participation and the voice of the child becomes very important, even as we do research, as we engage in policy, as we engage in advocacy. So for the time I've been at APHRC, which numbers now about slightly over 4 years, I would say that the center is very, very outright or intentional in addressing children, first of all, from an ethical perspective in designing research. A lot of work is put into ethical consideration through the ethical review processes to ensure that children's rights are protected. The center has established very strong safeguarding mechanisms, safeguarding policy, with ongoing sensitization of staff in terms of child protection, safeguarding of children in the course of our work, not just by APHRC staff, but by the people that we work with, whether consultants and those we engage with. And then in terms of their voice in capturing research and in our engagements, we champion participatory approaches. And I've seen, and I can attest to that in the course of our conversations, and I can give you examples for some of the studies we've done in Malawi or in Kenya, Burkina Faso, focused on children. And in this case, we were focusing on children who were pregnant and parenting. We call them pregnant and parenting adolescents. In all the occasions, these children were part of the conversations with policymakers, with particular attention, of course, to protecting their identities, but they had the opportunity to speak for themselves before policymakers. It's important to pay attention to that because many times we involve children on the premise of tokenism without really meaningful participation.
Yeah.
And we say there's nothing without us, for us without us. So we must be part of this conversation, and that is the voice of children. Again, the center looks at the child in their developing or evolving capacity. So paying attention to children who are able to speak for themselves, and for those who are not able to speak for themselves, seeking their guardians' support or parental support to be part of those conversations. In our engagement with policymakers, we front the rights of children across. And if you look at what I had mentioned earlier, we have our programs on ECD, early child development, and then we have our programs on nutrition. We have our programs that look at protecting children from harmful marketing for harmful food or unhealthy foods. We have programs across the center that look at the rights of children, and it becomes important for children to be part of that conversation. So I would say overall, the center scores very highly in advancing children's rights and involving children in conversations, be it at the research level, at capacity building level. And I would just add that whereas the center is not a child rights focused organization, we've also taken steps to partner with organizations that are child rights focused. So with a blend of child rights focused organizations with us, there is cross pollination in capacities to handle children and to involve children. So I would mention maybe 2 or 3 partners that we work with very closely in advancing rights of children and really to center children in the conversations. I'll say CRINSA, which is the Child Rights Network of the Southern African region, is a very key partner to us. ECRN, the East Africa Child Rights Network, which is a network of many organizations in East Africa that are child rights focused, that seek spaces to advance the voices of children. And we've also worked to some extent with the workshop, the West Africa Civil Society Organizations Forum. We worked with the African Child Rights Policy Forum based in Ethiopia in many conversations to advance the rights of children. So our input in that has been to facilitate capacity building on communicating or translating research or data to inform policy. To that extent, I would say having those partners with us has really helped us to grow our understanding of child rights, as well as looking at our programming from a child rights perspective. Mostly, it is one thing to look at children rights or child rights programming from a public health perspective, especially for a health-focused organization like us. But then having the conversation from a child rights perspective is key to advancing rights of children. So when we speak about child rights programming, we mean really premising our programming on these frameworks, which establish obligation on states to protect and advance rights of children, and also place responsibility to stakeholders, including parents, on parental responsibility for protection of children, as well as civil society organizations and other partners in advancing the rights of children. So that blend of partnership has really helped us to integrate children's rights in our programming, both at research, capacity strengthening, as well as policy engagement.
Yeah, I really like what you said about tokenism, because there's a very big difference in having children in the room just to say, oh, look, we had like 5 kids at our workshop or this conference.
Yes.
So we are involving children, versus actually giving them an opportunity to speak, to work on documents, to be an integral part of the process, whether if it's evidence generation or some sort of advocacy campaigns. There's a very big difference, and oftentimes we miss the mark. So it's very important that you highlighted that, and that you also highlighted that we are working with people who are more in tune with that space and more in tune with what it means to actually have children involved. This conversation would be very remiss if we didn't acknowledge the fact that we are 5 years away from the SDG deadline. So how do we then use the evidence that we generate? Because APHRC is an evidence generation institution. How can that evidence be used to further the cause of children, especially those who are in marginalized areas? And I'm sorry, I keep bringing up marginalized areas, but we can't be talking about leaving no one behind if we are leaving some behind. So how can we do that?
Thank you, Michelle, for that question. And you raised really very important issues there. We are looking at 2030, which is 5 years away. And I just wanted to add perhaps to that, we also have 2040, and there's a reason why I'm raising 2040. So let's look at 2030 in the context of Leave No One Behind and all the components of the SDGs, be it addressing hunger, be it addressing poverty, be it addressing health, be it addressing gender equality, education, be it addressing justice under SDG number 16, be it addressing partnerships under SDG number 17. Important. And maybe we could reference again where we are in terms of our indicators. I didn't get granular with the indicators. Perhaps you can have an opportunity to really look at that. And many of our work, if you look at what we have, say, for example, under Countdown 2030, tracking down maternal, child, adolescent health indicators across the continent, actually across the globe, if you may. Yes, you ask, how do we use this? How do we bring in data to help us advance this? It's important because data really gives us perspectives of the diversity of these children and really brings out those who are on the very far periphery of discussions on advancing SDGs. So research would definitely give us indications as to where those are, centering the farthest first, because under Leave No One Behind, you want to address really the most vulnerable first before you look at those with opportunities, emphasizing on equity, because equity demands that those who are marginalized should be addressed first based on the vulnerabilities. And secondly, data becomes very important because it helps us to track progress. Without data, then we cannot really track where we are. So it's a mechanism for measurement. It addresses really the progress questions. And then thirdly, data really helps us to inform decisions that we would like to take, be it policy, legislative, or budgetary decisions. And I would focus more on the budgetary decisions a little bit more, because that is quite in tune with this year's theme of the Day of the African Child, which is child-sensitive planning and budgeting. Child-sensitive planning and budgeting without data would be a big miss.
Yeah.
And it becomes then imperative that we invest in generating data. I think we've done pretty well with some investments we put in generating data across, and many other research players in the space. So towards 2030, I'm not so sure we may meet all our indicators by then, but overall, there's progress, and we are investing in data production to really inform decisions across the continent and help us engage with policymakers. And then I mentioned 2040 deliberately for a reason. Because other than 2030, which is a global commitment across the globe, we have 2040, which is an agenda for children in Africa. It is a 10 aspirational or a 10 aspirations policy document for the continent, developed by the African Committee of Experts on the Rights of and the rights and welfare of children in Africa. Since 2015, that document was passed in 2015. Just to point out that those particular aspirations speak to really the global commitments and the regional commitments on the rights of the child. Top of that is to center the African Charter on the rights and welfare of the child as the main framework upon which children's rights are advanced, and then centering progressive policy and legislative designs or legislative instruments to advance children's rights, centering the right to survival, and also really centering the voice of the children and aspiration number 10. So just giving you an overview of those aspirations. There are 10 of them. We may not go granular to each one of them, but that's the overall picture. We have this agenda to achieve by 2040. As to how we are doing towards that, I earlier on gave you indications on, first of all, our own commitments in terms of ratification of the African Charter on the Rights and Welfare of the Child. We said we've done the ratification. We have 3 or 4 of our member states still behind. But even among those that have ratified, we have those that have entered what are called reservations on particular provisions. Good example is the Arab Republic of Egypt, entering reservations around child marriage, entering reservations around the definition of a child. We had Botswana in that list, but Botswana removed the reservation on the definition of the child under Article 2 of that charter. So, yes, as we look at 2030, we need also to pay attention to 2040. And I had mentioned that our reporting as an obligation to the African Human Rights Mechanism is poor. We need to up our game in terms of documenting our progress and really accounting to the human rights mechanisms, and for this case, the child rights mechanism, which is the African Charter, the African Committee of Experts on the Rights and Welfare of the Child. Yeah, so in short, we are in a journey for both 2030 and 2040. We are 5 years away to 2030. We would say good progress, but we could do more. 2040, we are probably midway the journey. So we still have a lot of investment to do, a lot of awareness raising to undertake on this instrument, and even the agenda itself. If you went around, it's possible to find that people do not have an idea that we have Agenda 2040 on the rights of children.
That's true.
It's also possible that people do not understand the mechanism in Africa for advancing children's rights. At sub-regional level, it's also possible that we've not spoken to our regional economic communities as well, as far as advancing children's rights is concerned. To give an example of the SADC region, which has developed a number of model laws. They have a model law on GBV, gender-based violence, which also includes violence against children. We have model laws on FGM, which is a concern, of course, on children, harmful practices. So it's important, 2040. I think what is key is to develop proper child rights governance systems to be able to address the concerns towards that, ramp up our data collection on the rights of children, violation of children's rights, and of course advance stakeholder collaboration for us to move there together, and also support countries that are lagging behind, especially those in conflict. I would imagine that the African Union and the regional economic communities should take responsibility to really support countries that are in conflict, countries that are facing extreme climate conditions. Yeah, those are the challenges that are really beyond sometimes the states in terms of response to children's rights, but also the countries that are clawing back on advancement of rights. We would give examples like in Kenya, most recently when children were advancing a play which is intellectual growth for children. We want them to we're clobbering them, we send police to beat up children. So such like things take us behind. So we 2030, 2040, and we're still doing things that are taking us backwards. It becomes a concern. Thank you.
Okay. So earlier you mentioned that it's a mixed bag in terms of the commitments and what African countries are doing. And that is also reflective in the kind of development indicators that are coming out. And it looks like our North African neighbors are doing much better as compared to the rest of us down south. So then how can we, as different stakeholder groups, those of us who are in research, advocacy, academia, how can we work with government to move from just talking, from just the commitments, into solid investments that can actually make a difference to children across the continent?
Thank you, Michelle, for that question. I would say, first of all, I think it is West Africa that's doing fairly badly with regard to advancing children's rights. East and Southern, Midway, North Africa is doing pretty good. If you look at indicators for Algeria, Morocco, Egypt, Libya with all its challenges posts very good indicators on most of those things. But then to your question as to what can we do with government, or what can government as well do with us, of course. I hinted that multi-stakeholder involvement is very important in advancing rights and involving children themselves in the conversations. I would address the question in three parts. First of all, from the government side, you actually said ratification and signing the commitments is one step, but I think for governments, taking that to the next level to really translate that into national policy, national laws, national budgets, and national programs becomes key. So they should take center stage with the proper political will to be able to implement those. Governments should also take leadership in mobilizing stakeholders really to the discussion table to discuss matters related to children, to advance plans for children. Thirdly, it's important for government itself to take center stage to advance research and data on children, particularly monitoring of children rights and indicators related to children's rights. Fourthly, we've seen civic space narrowing across the continent. So it concerns many that those who speak about rights do not get the platform to advance rights. So for me, I look at government and tell them, please, it's important for you to really take a step back, look at those advancing rights as partners, not as enemies of government, and especially when we speak about children's rights. Yeah, it's important for all players to be part of that. And then to the donor community and partners who support this work, and I would single out some of those really very useful partners in advocating or funding and developing frameworks for child rights programming. For example, UNICEF, we speak about Save the Children. Those are organizations that have been at the center of advancing children's rights, not forgetting UN agencies also like WHO, UNFPA. They've been at the center of advancing children's rights. So what I would say for them is to really continue mobilizing the resources. We understand that the resource baskets are getting thinner and thinner. So diversifying our sources of funding and supporting local agencies to be able to program for children. And then also they hold very high stakes at global level. If you look at the UN human rights system, we expect that these global agencies are able to stand on those platforms and call out governments that are lagging behind, utilize many of those accountability frameworks. We have the Committee on the Rights of the Child under the UN mechanism. We have the Universal Periodic Review processes and other related processes on accountability on rights or human rights, if you like. So for me, those agencies should play a critical role. They do, but I think they can do better. And then for civil societies, organizations, and research institutions, advancing the collaboration is key because no one agency can do this alone. And it's also important to continually raise awareness among stakeholders. Stakeholders here ranging from communities themselves, children themselves, parents, people in the justice system. You look at the judiciary, you look at the police, and policymakers in government. I think civil society organizations still have a very huge role in playing the awareness raising and accountability check on governments. And then for research institutions, we can't belabor that. It's important to really continue generating data, especially if you look at the prevalence of FGM, prevalence of child marriage, assessments on where we are in terms of health indicators and the like. Yeah, so to inform decisions, research organizations must, and it's time to step up. With the resources dwindling, I think collaboration even in research becomes very important for us to generate the requisite data to help us make proper decisions as far as children are concerned. And yes, for civil society, maybe if I could go back, also documenting violations and advancing those violations in the right forums. These forums could be local human rights or justice systems through the courts, through the child rights structure. In many countries, we have elaborate children rights systems that we can utilize. The national human rights institutions were also very key to advance children's rights. So, Michelle, the conversation is larger than that. We could continue, but I think those are the top line that really we should advance as far as children's rights are concerned. Thanks.
Okay, so before you go, and just taking you back to the AU Agenda 2040, looking forward, what are some of the more positive, promising policy shifts that, promise or portend some sort of gain or transformation, positive transformation for Africa's children?
Yeah, okay. So the context of our conversation is the Day of the African Child, and perhaps it premise it in context would be, we began this conversation, say, in 1991, when the AU really declared this is an important day to commemorate these children who, to me, are champions of rights because they stood and spoke for themselves. We go backwards to when that happened, which is 1976. In between, at the global level, we've had a framework that protects children, which is the UN Convention on the Rights and Welfare, on the rights of the child. And then the African, more context-specific instrument for Africa, which you have spoken about, the African Charter on the Rights and Welfare of the Child. Those are instruments that we brought in as protective mechanisms for children. Increasingly, we have advanced spaces for voices of children to be heard. I've been privileged to be part of conversations happening at the African Committee on the Rights and Welfare of the Child. And if you look at the structure of that institution, they have what they call special mechanisms. And I like that framework because it really helps to look at children in their diversity. For example, if you picked one of the special mechanisms, which is the Special Rapporteur on Health, Welfare and Development of the Child, who is a very good friend of APHRC, Honorable Elgera, who's been part of our conversation. So I think with those kind of frameworks or those special mechanisms, we've seen more focused address to children's rights. And then nationally, a number of countries have advanced rights. If you look at programs in South Africa, for example, supporting adolescents, social protection programs. If you look at Kenya, we've had a journey of reform of the children's rights space, beginning way back in 2001 and more recently in 2022 with the new Children's Act, which expands programming on children and child rights protection. Across the continent, we have many countries that have made progress. I would also cite countries like Rwanda, on really, because Rwanda is advanced in terms of maternal health, which translates as well to protection of children from a health perspective. So programs, policies, and legislations are coming up, aligned with the international frameworks, more importantly, because we have the gold standard, which is the UN CRC, the UN Convention on the Rights of the Child, and the continental gold standard, which is the African Charter on the Rights and Welfare of the Child. And then we put together this elaborate 10-point agenda for us to look at. So I would say we are not short of policy frameworks. Perhaps what we need to do more is to implement that. And for countries that are still lagging behind in terms of domestication of those policies or those gold standards, then an opportunity to really domesticate and implement. And then financing also remains a concern. So we need to look at our national budgets to be very conscious and sensitive to programming or budgeting for children's rights. And lastly, I think centering participation of children. I think I've said that more than 3 times here. But yes, children remain a part of the conversation, and they should inform us what is best for them, anchoring it on the best interest of the child. Thank you.
I think that's more than a great note to leave that conversation on.
Thank you, Michelle.
That we can do more and that we can do better with and for children in Africa. Thank you very much, Wakili, for coming through. That's it from us.
It was a privilege for me being with you. Thank you very much.